Hello, my name is Andres Luque. I'm talking about central Pontine myelinolysis. Definition. The central Pontine myelinolysis is osmotic demyelination syndrome that in most cases occurs of rapid correction of hypernatremia. There are a number of situations that are associated with an increased risk, such as alcoholism, malnutrition, prolonged use of diuretics, and life transplantation.
Welcome to USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1, 2013 edition.
Page 419.
Central Pontine Myelinolysis. What is central Pontine myelinolysis? Central Pontine myelinolysis is a condition in which there is acute paralysis, dysarthria, dysphagia, diplopia, and loss of consciousness. This is a condition that can cause locked-in syndrome, and in this there is massive axonal demyelination in the pontine white matter tracts. What is the cause of central pontine myelinolysis? The cause of central pontine myelinolysis is iatrogenic, which means it's physician-induced, and this is caused by overly rapid correction of the sodium levels. So when you correct hyponatremia, you do it very fast, then central pontine myelinolysis can happen. For more information on this topic, click on the link in the description section below. For a full USMLE Step 1 review, be sure to check us out at USMLEFasttrack.com, where we help you review the entire first aid for the USMLE Step 1 with high-quality videos and hundreds of detailed pictures for a better understanding of the material. So to learn from the best USMLE review book, be sure to check us out at USMLEFasttrack.com.
Application in medicine. When the myelin sheath that covers the neurons is destroyed, the signals from one nerve to another are not transmitted correctly. However, the brain stem is the most affected. Other areas of the brain may also be affected. The most common cause of ODS is a sudden change in sodium levels in the body. This happens more frequently when someone is being treated for low level of sodium hyponatremia and sodium is repletion too quickly. It can also occur occasionally with high levels of sodium in the body hyponatremia as correct too quickly.
Central Pontine myelinolysis, or CPM, is a disease of the nervous system that is caused by irreversible damage of the myelin sheath of neurons of the pons, part of the brainstem.
This damage happens due to the extremely low levels or sudden rise of sodium levels in the blood that tampers with the osmoregulation of the neurons. It can affect everyone, especially those with alcoholism and malnutrition. Although there is no exact epidemiology regarding this disease, post-mortem studies of liver transplant patients show that it is more frequent in females. Anyway, CPM manifests by general muscle weakness and wasting, difficulty in speech, difficulty in swallowing, and poor balance. Mental confusion and hallucinations can also be experienced by a person who has CPM. It may even result to the locked-in syndrome or being paralyzed completely or seizures. Ultimately, it may result to death. So how does this disease come about? It is accepted by medical research that the brain cells or neurons also adjust to the condition of the environment via osmotic action. The osmosis to maintain cell balance is facilitated by osmolytes like sodium. When sodium levels in the blood get devastatingly low, a condition called hypoatriemia, the cell environment would be absorbing free water. This is conversely true if the sodium levels are very high, or hyperatriemia. Water will be expelled from the cell passively resulting in the destruction of myelin sheath, the lipid-constituted covering of the axons in the neurons. So what if the myelin sheath is destroyed? This structure in neurons allows faster propagation of electrical impulses, which is important in a proper function of the nervous system. When these structures are destroyed, especially those of the pons, which is the messenger for the different parts of the brain cannot function properly. This results to the difficulties mentioned earlier, from muscle pain, difficulty in swallowing, or death. Given that the person is already diagnosed with this dilapidating disease, what can the current medicine capabilities do? Only the strict monitoring of sodium levels can slow the disease, but the rapid reversal of the existing drastic sodium levels will result to worsening of the disease as the neurons are not accustomed to such rapid changes. Once the myelin sheath has been destroyed, cure is a very long-term process. Medical attention given to patients is just supportive, although it may be curative after a long time has passed by.
It is very alarming that this disease can occur in malnourished individuals. It can range from nutrient deficiency to electrolyte imbalance. Fluids, especially water, should be adequate for the body's needs. Sodium requirements should be taken at 500 milligrams of sodium via fluids according to the 2002 recommended energy and nutrient intake as headed by the FNR-IDOST or the Food and Nutrition Research Institute of the Department of Science and Technology. Also, it would be better to take alcoholic drinks in levels by which it won't be toxic for the body.
Let us think about how many people in our country, or even in the world, are in danger of having, or are currently suffering because of CPM. We hope that this video of awareness will allow more actions from UP students, RNs, and the world.
Pros and cons. The SDO is an emergency that must be treated in the hospital. Although most people with this condition are already hospitalized because of another illness, there is no cure of potent central myelinolysis. The treatment is oriented to where there rely of symptoms. Physiotherapy can help maintain strength, mobility, and muscle function in weakened arms and legs. Pontine myelinosis and extraproteins is usually caused by rapid curation of hyponatremia. Other cases have recently been reported in relation to hyperglycemia and ketoacidosis associated with alteration of natremia. Conclusion. In the hospital, slow and controlled treatment of low sodium levels can reduce the risk of nerve damage in valoric bridge. Knowing how some medication can change sodium level can prevent this level from changing too quickly. Thank you. See you later.